Hi, I'm Steve Brown, Director of AVO, the AI Institute's virtual organization. There's a new AI Institute. I had the pleasure to have us chat with the director of the new institute at the campus of the University of Delaware. I visited with Dr. Kathy Wu. The new institute's name is the AI Institute for Human AI Cooperation, or HIKE. Here's a portion of my interview with the director of that new institute.
We are very lucky to have a very strong partnership. So in addition to the University of Delaware, we partner with Delaware State University, another university in Delaware who we collaborate closely with. And also we team up with University of Pennsylvania, University of Florida, as well as Princeton University.
Let's talk about the origin story. What was the original idea behind the HIKE Institute?
Yeah, the academic home of our AI Institute is the Data Science Institute, which we established about 8 years ago at University of Delaware. And so it is really designed as a new creating force or focal point for us to bring faculty across colleges from the university together to conduct interdisciplinary research relating to data science. And so we wanted to, work together as a team and then explore any areas of research that are impacting our society. And so the NSF National AI Institute really is a perfect initiative for us to realize that kind of vision that we have, that we wanted to bring team science to advance foundational AI knowledge and improve healthcare.
Let's talk about the team now, their talents and expertise. What's the range of domains of expertise amongst your teammates?
Yeah, so in order for us to accomplish the goal, we really need to integrate multimodal sensing, multi-scale modeling, human-centric decision-making, and develop the kind of AI systems that will personalize interventions in health. And we need to adapt to context and instructions, support more effective and responsive care. We need to bring together a tremendous team of experts in foundational AI, machine learning, reinforcement learning, knowledge graph, large language models, agentic AI, as well as in domain areas like physical therapy, rehabilitation, engineering, robotics, neuroscience, biomechanics, and AI ethics. And so basically that's what we do. We bring that team of expertise together across the partner organizations.
Here's the Deputy Director of HIKE, Austin Brockmeyer.
The bridging between the personalization, where every individual is going to come in there with unique situation, unique challenges, right? And the population of, if we could leverage a much larger data set from multiple clinics simultaneously, if we could simulate correctly at a level of fidelity that enables simulation, could we ensure that we've learned something sort of meaningful in that simulation world that can enable us to take anybody, go into the clinic, and speed up that process of getting something tailored to them?
Universities do the heavy lifting of research. What are some of the hard problems that HIKE is attempting to investigate?
I would say the greatest challenges that we have is alignment. How do we ensure that AI aligns with human goals? And so the fundamental problem we are addressing is human AI cooperation and teaming. So we really are working on building on teams where clinicians and AI can work hand in hand together, and we can align with the clinical goals so that the AI will become reliable, trustworthy teammate.
Looking at the longer-term horizon, what are some of the ultimate goals that you hope to achieve?
We wanted to instill trust and evidence-based policy in AI-powered, robot-assisted personalization.
What is exciting you the most about the possibilities of Hike's research?
I'm actually very excited about all the aspects that we will be engaged in, and whether it is the foundational development, whether it is the the healthcare impact, the way that we will be able to work with stakeholders, work with patients, work with clinicians, and again, work with students, potentially the next generation leaders in the field.
I was talking with Austin last week about some of the areas of research that you're doing, imagining a person with a prosthetic presenting with a problem and the nature of machine learning involved. Tell us about the thought process that goes behind that type of research. It sounds very interesting.
Yeah, so I think Austin probably also mentioned about digital twin. Yeah, so I think the idea is that we are going to have, again, all these kind of sensors, all these kind of multi-model modeling capabilities, and together with the kind of data we will be able to collect, the kind of underlying algorithms that we will be able to, work on, and put that into this kind of digital twin environment where we can do a lot of the experiments virtually, the modeling, the simulation, and then have immediate feedback from all the data that we are collecting from the field, so that a patient doesn't have to wait until the next visit to kind of, revise their routines to care for themselves. And so I think it's just sound like a science fiction, but that's really is the dream. That's what we would like to accomplish with the technology, with the digital twin, and with all the expertise that the team that we have together. I think, yeah, it's going to be extremely exciting.
Is there anything else that you'd like to tell the other institutes as you launch?
Really think about what we can do together. And so we have our working group meetings, and we went through all that process to have this kind of real teaming. And so I think it's just so exciting that now that we can turn all those teaming, those ideas into reality, to actually work on it alongside with our students. And so, yeah.
It's exciting. Thank you very much.
Yeah, wonderful. Thank you so much for taking your time.
You're welcome.